Angela. Angela is a licensed social worker. She specializes in working with children and adolescents. I've known her for a long time. She is an amazing therapist, and so we are so thrilled that you're going to visit with us today. A lot of the folks that come through our doors on a regular basis are young parents. We have a lot of expecting mamas as well. And so we wanted to do a community driven discussion about what it's like to be a parent, a new parent, and what it's like to be a new parent in the midst of COVID-19. And so we are just so excited to pick your brain and to process through this with you today. So thanks again.
Yeah, my pleasure. I'm so glad to be here. Thank you both for having me. I'm just stoked to be here.
Yay!
Give us like an introduction of who you are, your credentials, your experience.
Yeah, sure. Yeah, so my name is Angela. Like Christy had said, I'm a licensed clinical social worker. I've been a licensed social worker since 2008 and a clinical social worker since 2013. I've worked in a variety of environments, nonprofits and corporate, and hospitals, residential treatment centers. I've worked with teen moms. I've worked with foster youth. I've worked with in adoption with both adoptive parents, those like seeking adoption, and with birth mothers as well. Like in the hospital with both parents and birth mom. And I've also worked with geriatric clients as well. So I've really seen the entire lifespan into this world and leaving this world, hospice, I mean, you name it. I've volunteered at the bereavement center, and I'm currently in private practice mainly, but I also work with military family and youth, just the dependents, and just how to cope with all the challenges that come with military life. So that's a little bit about me and where I'm at today.
I'm curious, what types of things are coming up in your sessions right now in the midst of COVID-19? You know, protecting your clients' confidentiality, but just what are some themes that you're seeing, and what are some things that folks are going through?
Sure. I'd say some of the biggest ones are, how do I maintain a sense of normalcy when normalcy was completely taken from me, right? Even if it wasn't just about, I used to go into a facility or an office for work, I'm at home. But even my day-to-day routine, and especially for stay-at-home parents that I work with, if they had a routine of, I'm going to get up, I'm going to go to the gym, I'm going to then go to the store, and I'm going to do drop off at school, and then I'm going to go do this, or, they had their own routine about how they would function and make sure they were servicing their families, meeting their families' needs in the best way they could. That is totally different now. And it's difficult to find a new normal when everybody had their own compartment, right? Like every family member would go to their separate areas of the world during the day, and they knew how to navigate through. But now being all at home together, maybe even being with your spouse all the time, and you weren't used to that, that has come up a lot for a lot of my couples that I work with. They might have been dealing with other issues, and all of a sudden it's like, and now here we are in the same room all day, all the time. So yeah, I think, right, so if I look at overall themes, it's how do I create a new normal? How do I maintain routine when, everything I knew about a routine was just taken from me. The concept of time has changed. And maintain healthy relationships during time those are probably the biggest themes that I see. And then obviously broken down into what kinds of relationships, and those are definitely the biggest themes. And for parents specifically, it's how do I shift into these roles of, I need to meet my child's needs as a school teacher, but I also still need to be their mom, but I also need to, to my older teenagers, be somewhat of a friend and a listening ear, but hold a limit, but they're not allowed to go anywhere anyway. So do I allow them more freedom? So this idea of who or what a mom or a dad is, that role has shifted a lot. And that's creating some confusion with them as individuals, right? As an individual parent, what does that mean? And how does that change my identity? Am I capable of doing that, right? So then there becomes all these other questions of, can I actually do this? Mm-hmm. Yeah. So lots of self-doubt coming in, so yeah.
And I would imagine too, in addition to all of those situational changes that are happening, right? I would imagine like if a person already has some underlying mental health concerns or, has a history of say something like generalized anxiety, I would guess that a lot of that is just getting like amped up extra too during this time.
Yes, definitely. Any of my kids, I work with several school age children that have pretty significant anxiety, and they have just come off the hinges at this point because the way they knew how to cope, right, worked within, again, their routine and their structure. And then all that was taken away from them. So they don't know to trust that those same things can help them in the same ways, right? Because now they're in an entirely different situation that they don't understand. And especially for kids, I mean, they don't understand. I mean, we barely understand as adults. So, what are they doing? So yes, and for adults, I worked with a woman, middle-aged today, suffers from pretty chronic depression. And she was actually doing really well, had been maintaining a job, was doing all of her, hygiene daily, um, had gotten a new place to live, really been doing well for herself. And then this hit, she was laid off, and has just been inside her apartment. And she lives alone anyway, right? So the job actually allowed her access to, human interaction, to practice socialization and communication skills, to practice coping with any kind of anxiety that might come up, in the real world. It really just allowed her to challenge herself in very healthy, appropriate ways. And all of that was gone. And so how do you deal with that? So yes, underlying mental health issues have just been exacerbated in so many ways and taken on new forms that, maybe people hadn't even dealt with yet. So that's been an extra challenge for sure.
One of the things that we really specifically wanted to hone in on was the experience of expecting parents. So maybe you could share a little bit more about, what is it like first to be a new parent, and then what is it like to be a new parent now?
Right. So great questions. So, right, being a new parent. And first, I want to preface that I am not a parent, but I have walked alongside with so many parents. So I want to be 100% transparent that I'm not a parent. I feel like I've helped raise, like 200 children with everything that just throughout all of my work, but I can't actually claim them as mine, although I would want to sometimes. But anyway, so I just want to put that out there. But based on my work and based on what I know to be true, what I've seen play out, right? So being a new parent, already wanting to get it right. There is no manual. Your parents can tell you how they did it, or you can see how your parents did it and go, that's not what I want. Or, my friends, they have it together. That's what I want to do, right? Like, so we have all of these influences of how we want to be, right? The kind of parent that people are going to strive to be. And maybe not. Maybe you and your spouse are just really connected and you're like, we're going to create our own way. This is what we're going to do. And that's awesome. But still, there's no manual, right? So still trying to figure this out step by step. So pregnant, already, feeling anxiety anyway, can we do this as parents? Then enter COVID and quarantine and access to maybe our support networks, like physical, tangible support networks that we no longer can be around. It just adds this entire other level. I'm going to say blanket, because really like a weighted blanket of uncertainty. Because we can't always see through it, the level of uncertainty that comes, right? And so now with quarantine time, I mean, I know hospitals have so many new precautions and some of those are trying to be changed, but as new parents, your family doesn't get to be there with you. And extended family cannot be there to support you. And maybe you thought you were going into labor and you weren't. And so all the support you would have with all of this back and forth, or maybe it's a challenging pregnancy. And again, you don't have that physical support there. So I think having this physical distance in place has just made it that much more challenging for expecting parents. From what I've read, from parents that I've worked with, that I'm currently working with, that is definitely what I'm hearing and what I'm seeing, right? So being a new parent can be really exciting. And again, we can do this, and this is going to be our journey and our life. and not really sure how it's going to work out, but we're going to just like hold on and make it happen. And now we're going to hold on and make it happen, and hopefully we get through tomorrow, because we don't know what will happen, right? Like there's just such this intense level of uncertainty that again brings on this idea of, but can I do this now? I felt like maybe I could do it before all this started, but now I'm really ready, because I'm going to do it without, mom can't come visit now. I'm not going to have the activities that I was going to have. Like we have to just figure this out, the two of us. And that can be very overwhelming. Or for single parents, how do I do this now on my own? Like truly on my own. When I had friends or family that was going to be able to support me, and now I don't have extra hands.
Yeah.